This looks good. I want extra logo.
Good evening, and welcome to African American Wellness Watch, brought to you by BlackDoctor.org and the African American Wellness Project. I, of course, am your co-host, Ellis Dean, for this wonderful program that we have scheduled for you this evening. So on tonight's show, what we're going to do, we're going to give a quick COVID update. It is changing daily, so we have our friend of the show, Dr. Oliver Brooks, is going to come in and give us a quick COVID update, and then our star of the show is going to be Dr. Glenda Newell Harris. And if you know that name sounds familiar to you, you've seen her here before. She is a wonderful doctor and co-wrote a book about being your own best health advocate. And so what we're going to do tonight is we're going to teach you how to advocate for yourself and why it's important to be able to advocate for yourself and share it with your family members. So we're going to talk to her really quickly, and then we got a small video that we're going to show you as going to be a cautionary tale as to why you should be your own best health advocate. So we've got a fun-filled show for tonight, an action-packed show for you tonight with a lot of energy. The question of the night that we want you to ask is, what is the most important thing that you need to know about your health? And so we're going to ask Dr. Newell Harris that question. We may even ask Dr. Brooks to see if he can answer that question too. But I'm going to be quiet, and I'm going to let the man of the hour jump on the microphone. Dr. Lenore, how are you doing this evening?
I'm good. Why am I just the man of the hour?
Because that's all we got tonight.
Man of the day. No, we're so excited to be with you today. We're going to talk, like I said, Mr. Dean has talked about with Dr. Oliver Brooks. He's going to talk not only about what's happened, what's happening now, and what's likely to happen in the future with regard to the coronavirus. And I think you need to listen, because there's certain implications that you assume when you decide not to take the vaccine. And I think you need to know what's in store there. And Dr. Glenda Newell Harris and Dr. Brenda Spriggs has written the Bible for the African American Wellness Project. I use Bible in quotation, so I don't want to get any feedback on that. But if you are serious about taking care of yourself and your family, you need to listen to Dr. Glenda Newell Harris, and you need to buy the book that she's written. Every Black family should have this book. Every single Black family. But first, I want to just acknowledge that there are other things going on in the world besides the coronavirus. I want to look at some of the statistics that say that many of you, because of the coronavirus, are not getting your regular visits. You're not checking on your heart. You're not checking on your lungs. You're not following up on some things. You're not getting the appropriate screens for breast cancer, prostate cancer, and so on. And you're not taking your children in to get the regular growth analysis that they need, and you're not taking care of yourself. So I want to say to you, look, this virus is about to at least tamp down. It may not be ready to end, but it certainly is slowing down. And so there'll still be, if you still look, this is only the third leading cause of death in the United States. First leading cause of death, heart disease. So we wanted to focus on exercise, diet, and stress reduction. Second leading cause of death is cancer, and early screens is a big deal here. And we want you to understand that the telehealth medicine may seem to you a bit impersonal, but it's still better than no medicine at all. So please don't forget your regular visits to the doctor for yourself or your children, and certainly take your elderly relatives to the doctor and to get them their regular screenings for the chronic conditions that they have. And I think that's what the big news is now. And looking at the statistics, we're not taking care of ourselves in the way that we were before the virus, and we need to start.
Well, that's absolutely correct. I think that I read a statistic that said that 80% of the people that have the most complications with COVID were obese. And so that is a direct result of not going to your regular checkups, not taking care of yourself. You become obese, and then if you catch COVID, it's going to make those symptoms more complicated.
And I believe in keeping it real. You're too big. You're just too big. I mean, you need to start thinking about what that implication is for you in terms of lifestyle and longevity. And if you look at any statistic, any significant weight increase over what we consider the basal metabolic rates reduces your chances of living not necessarily longer, but certainly less healthy. And this is just another instance. Certainly those people who are overweight are much more susceptible to coronavirus, but you're more susceptible to heart disease, lung disease, and diabetes, and so many other things. So let's not mince words. I mean, I'm certainly no exception. I mean, in fact, you've already convinced me not to eat the meal I had planned already. But look, you need to start thinking seriously about the implications of being overweight, and certainly the implications of not going to the doctor and getting your regular visits. So with that, I'd like to take the time now to introduce Dr. Oliver Brooks. Dr. Brooks's resume is much too long for me to dwell on the detail. He's the past president of the National Medical Association. He is the director of a large multi-ethnic clinic in central Los Angeles, practicing day to day. Dr. Brooks has been on a number of distinguished panels dealing with the coronavirus, and we want to a little bit differently today. Not so much about what's happened, although we should talk about that, what's happening now, but what's likely to happen in the future. Not just from a medical perspective, but from the perspective of what it means for you to live without being vaccinated, and what it means for you to live. Let's flip it. Without what it means for you to live with being vaccinated. So, Dr. Brooks, welcome to our program.
Good evening. Thank you, Dr. Lenore, and good seeing you again, Ellis Dean, and thank you for BDO for being involved with this. So, I look at being vaccinated as it's vaccine with benefits, okay? Because people think, okay, it protects me from COVID-19. I am likely not to die. I won't get hospitalized. But what you can do if you're vaccinated, you can be around other people that are also fully vaccinated without exercising masks and distancing. So that is a great benefit. I had my first outing with friends at their house, though I was outside and kept my distance, but I felt comfortable. Number two, you can go into a household of people that are at low risk. So let's say you're a senior, you got a daughter that's 30 and she has a 10-year-old and an 8-year-old. If they're all at low risk, you can go into that household and feel comfortable. So those are very significant benefits in terms of being vaccinated. But I'll say also importantly, it's just that mindset. I know I'm fully vaccinated. I feel good. I feel strong. I feel like I am not vulnerable to the virus, though I am, and I keep my mindset straight in terms of edge control. I feel comfortable. It's a different mindset when you are vaccinated.
Dr. Brooks, do you think, I've listened over the last several months to logical discussions about why not to get the vaccine. But do you think that the fact that almost 64 million Americans have been vaccinated, do you think that blows away some of the excuses people have or reasons and rational reasoning that they have for not getting the virus? I've been very, very, I think doctors should be very tolerant of people who make these judgments. But with so many people getting the vaccine, with so few side effects, with so much protection, is there even anything left for you to rationally say that this vaccine is not for you?
No, it's just if you're irrational. You mentioned 64 million people. So the studies were done on 30 to 42,000. So now we have, 100 times that the people have been vaccinated, more than 100 times that. If there were something significantly wrong with the vaccine, it would be out there right now. So the best study is what's called post-marketing, which is what we have after the vaccine phase 4. So no, there really isn't. And I think the other thing to understand, and it's important to me for people to understand, not getting vaccinated is an active decision. I think people look at, okay, I don't get vaccinated. It's just like I just didn't do it. I didn't act. But not getting vaccinated is an action, and it puts you at risk. And importantly, it also puts other people, it puts your family at risk. It puts your friends at risk. You're going around potentially with a higher chance of spreading it. You're going around with being sick. If our own people are getting vaccinated, the people the black people, the people that are worried about Tuskegee and Henrietta Lacks, okay, if the guys were alive from Tuskegee, they would say, why are you not? We were denied treatment, and here you are. You have effective preventive measure. You're not doing it. Henrietta Lacks said, well, they used my stuff and didn't get my permission. Now they're explicitly giving permission and giving me all the information, including me in the trials with full notification, and you're still not doing it. So I'm sorry. If you're not vaccinated, you're making a decision that is harmful to you and the community. And last thing I'm gonna say real quickly, my concern in looking forward are these variants. Okay, the Brazil, the UK, South Africa, there are actually 2 in Southern California right now. So if people are vaccinated, those variant infectious agents are less likely to spread and less likely to get out there more. So if you're not getting vaccinated, you're also making sure that these variants are getting out into the community, into the world, into the population, to your people and your families, and you're putting us all at risk.
I've got Dr. Brooks here in front of you. And for those of you not getting vaccinated, I'd like for you to make the comments as to why now you're not getting vaccinated. I think all of us as Black doctors understood that you have the right to make a good judgment. But what kind of judgment are you making now when your older relatives are at risk and your family's at risk? And with the opportunities in front of you, if you do get vaccinated, and those of you who got comments about not taking the vaccine now, I'd like to know what the rationale is. It just doesn't, for me now, I think it would be disingenuous for us in the African American Wellness Project, for me as a Black doctor, to say to you, only 8% of the vaccinations have gone to African Americans. And I think that, for me, is a dangerous statistic. One of the things that we should talk about, and perhaps we get some feedback on that, is that what is life going to look like for you if you're vaccinated as we move forward?
So if you're vaccinated, again, you can go out. There's even some information that you can go into small gatherings outdoors without, I'll say without concern. I still will wear a mask. I will still do my best to do some social distancing, but with that, you have more freedom. We are looking toward having what's called a COVID-19 passport. And this is going to be some type of documentation. I think it's quite reasonable also, such that you may have to demonstrate that when you go certain areas, let's say, for example, right, looking at when you travel, when you go to a concert, when you go into a restaurant, when you go anywhere where there's congregate, opportunities, people to be together, you show this and you're able to get in. And this is already happening in Israel. And there's discussion at higher levels of the government. It's going to be private. It's going to be not necessarily mandatory, but it's just like, hey, I got an extra pass. I'm good. I'm fully vaccinated. So that's what life is going to look like. And the other side is, if you're not vaccinated, ultimately people are going to look at you now. Why not? What's going on with you? I mean, I wasn't going to get vaccinated. They're going to say, I know, but I finally figured it out. What is going on? What is your logic? Now, the only other thing I'd say, people are worried about, well, what happens long term? Well, the studies began in March of 2020. We got people that have been out a year. We have clear data on people that have been 6 months out, no problems. So generally speaking, vaccines don't do things you 2 and 5 years from now. If it does something, it generally does something in the first couple of weeks, couple of months, we're out. That's done. That horse has left the barn. Doors closed. You need to get vaccinated.
But you remember what it was like sitting in a little jazz club? Maybe I don't want to say you had a little drink in your hand, but listening to good music. At the club, going to see Frankie Beverly sing that same song 500 times at every one of the festivals. You remember what that was like? You remember what it was like to go into a basketball game to see your son and daughter play basketball. You remember what it was like when you went to lectures and you went to rallies and your groups got together. That is still possible, but it is not possible if you're not vaccinated. Don't you believe for 1 minute that you're going to be able to walk into the venues that you used to like without showing that vaccination card? I'm not necessarily in favor of that, so we've isolated people. But there is what is, as my grandmother said, and here's what ought to be. And what is that they're going to have that card. And I think that if you are not vaccinated, and if you've got a reason for not being vaccinated now, I just think that you're dealing with the lost contact with reality. Now, I've never been this dogmatic about that, because in the beginning, we didn't know what the vaccines were going to do. We didn't know what the side effects were going to be, and we're letting other people tell us the importance of vaccination instead of us talking to each other. I think the other thing is that, look, if you decide after all of this information not to get vaccinated, we're not going, obviously, as a physician, I'm going to take care of you as much as I can and your children as much as I can. But you better talk to your older relatives. Don't let your older relatives not get vaccinated. You go there and say, look, I've decided not to do it, but my risks are not the same as yours. And so consequently, you need to talk to your older relatives about getting vaccinated. Just because you've made that as a conscious decision, I still respect that. But you need to talk to older people in your family and make sure they get vaccinated. If you have to drive them somewhere, you can stay out of it, but don't leave your older family out of it.
Well, I would say this. There's a couple of things. First, I want to give a shout out to Cherie Dampier. Appreciate the fact that she said she was fully vaccinated. And not only is she fully vaccinated, but she dropped 65 pounds so she could get out of the obese category. So shout out to Cherie, and I'm giving you all support here to continue the work that you're doing to increase your health. There's also a question from Ruth Wyatt. She's asking what's in it. I would just direct Ruth to go to the blackdoctor.org COVID-19 resource page. There are a number of videos that talk specifically to what is in the vaccine. And Dr. Brooks, I know you know what's in the vaccine, so if you could give her a quick answer on that. And I will tell you a personal anecdote. I have been doing these, hosting these and producing COVID virus and vaccine videos since October of last year. I know about as much about the vaccine as many medical professionals do. And I will say this, I was still apprehensive going in to get vaccinated. So what you're feeling, any apprehension you have is absolutely normal. It is absolutely okay to be apprehensive. What made me go do it was knowing the other side of that. By making, and Dr. Brooks is absolutely right, by saying I'm not going to get vaccinated, you're making an active decision to open yourself and your family up to being ill and having the long-term effects. Because you can ask about the long-term effects of the vaccine. That's being studied. Also, what's being studied is the long-term effects of catching COVID, and that is still unknown. And we're talking about brain diseases and all type of things. I don't want to deal with that. I'd rather deal with the vaccine. So Dr. Brooks, could you briefly talk about what's in the vaccine?
Okay, so primarily in the messenger RNA vaccines, you have some lipids, which are fats that what is used to encase the messenger RNA. There's some salts like potassium chloride. The main ingredient that people seem to be having some issue with is something called PEG, polyethylene glycol. It's used as a laxative. It's been used as a food stabilizer for decades. So it's been in general use for over 20 years. Some people can have an allergic response to that. If you're allergic to PEG, or you have some severe allergic response to other things, and an anaphylactic response, and Dr. Lenore is a specialist in allergy and immunology, then that would be of concern. But there is generally nothing major in them to worry about. The other thing, I hear like, what's in it? Are you asking me that if you went to the hospital and had to get a shot of penicillin? Are you asking me that everything that you eat? Are you asking me that with other medicine, your pills that you take? We do have concern. I think it is not unreasonable, but I think there is so much focus on that particular aspect. What about the soap that you put on your body? What about the mouthwash that you use? Polyethylene glycol is in toothpaste. So, I understand there is a resource where you can go online and you can see everything that's in there. Okay. I too had some concerns, Ellis, I have to say. It was a messenger RNA. It was a new platform. But the choice was getting vaccinated or getting COVID. Okay, I'm working. I'm out there. People are coughing and breathing and come close to you. So I also looked at the messenger RNA. It's a tiny. I mean, it's so well engineered. I had less worry about that than other vaccines because there's so little in there. It doesn't affect your DNA and doesn't make you infertile and doesn't have a microchip in it. So that's what's in it. Very minute amounts of non-specific material. And if you really want to know the specifics, you can go either to the CDC or just Google it, and it shows up exactly what's in the vaccines.
Now, I would like to say, as we end our conversation on this, to Ruth, you're absolutely right to be concerned about it. But what I'm more concerned about, and what you should also be concerned about, is the residual for people who had the coronavirus. There was a study out today that those people who got the active virus, 1/3 of them had some kind of mental problem, and not necessarily the stigma of the kind of mental illness we've talked about before. But these people are having difficulty remembering things, understanding things, and it seems like the vaccine reduces some of those side effects. So we didn't come to this decision easily. I mean, we want, as in the African American Wellness Project, and I congratulate Dr. Brooks on probably one of his highest honors, being the chair of the board, who chair of the board of the African American Wellness Project. But we in our project have really been very concerned about this virus and giving African Americans the best information. Those of you who had allergy reactions to vaccines, we can test for polyethylene glycol. Sorbate, I guess it's sorbate. But we can do those tests. And if you're having a trouble or you're concerned, just get your vaccine near a hospital, where if anything happened, you'd be certainly able to get it. But in summary, I would like to say we've had a lot of people vaccinated now with very few side effects and a whole lot of protection. What I see now is the country opening up much too early. So those of you who are unvaccinated are much at unnecessary risk, because we should have waited a minute, before we opened up completely. For me, I'm gonna be wearing this mask probably through 2026. I mean, I'm not giving up my mask. And you know why? Not only did I not get the coronavirus, but I didn't get a lot of other viruses I usually get during the winter. So thank you, Dr. Brooks, for joining us, updating us on the virus. For those of you who've gotten the vaccine, I see a lot of you are endorsing the fact that it was not the terrible situation that you thought it was. And I think that you have to talk to your friends and your relatives. Our percentage of vaccinated people has been at 8% for over a month. And I think because of the necessary situation that we are facing, that we need to start speaking more frankly about the dangers of not getting vaccinated and about the advantages of getting vaccinated. Not to challenge your judgment, just to be keeping it real. So
Dr. Ladora, let me say one quick thing. One other reason may be people's pride. I said I'm not getting it. So 3 months later, I changed my mind. Oh, so don't let pride get in your way, okay? It's your health is more important than swallowing your pride and getting vaccinated.
And I'd say one more thing in answer to a question from one of our viewers that her daughter has a tree nut allergy. She should take the vaccine. Look, the vaccine is really not, there's nothing about a tree nut allergy that would prevent you from getting the vaccine. The vaccine is more dangerous for people who've had trouble with subsequent vaccines. But if you look at the statistics, less than 5 in a million people have had any kind of major allergy reaction to the vaccine, and none of those people have died from that vaccine. So I'd like to stop this segment. Thank Dr. Brooks.
Thank you very much.
And I hope that you take our dogmatic and imperative approach as a sign that we love everybody out there. And I'm giving it my best. I'm giving you my best judgment. There may be others who think differently, but for right now,
I think, and it's in the comment section, and I just want to address it really quickly. And Sherry brought this up. It's amazing. We've had a number of doctors on the Black Doctor site. There have been doctors on CNN and all the other news sites talking about the safety of this vaccine. But if they see one article or one internet video that says it's not safe, those people will parade that around. And I'm like, there is a preponderance of evidence showing that this vaccine is safe. Again, it is your decision whether to take it, but you cannot use false or one example and say, well, it's showing it's not safe. There are millions of people that have gotten shots and are fully vaccinated, and many millions more that have gotten both shots and are walking around and have no side effects other than sore arms and some fever for a day or two. So please, please, please do not just hold on to the one thing that supports, that affirms your suspicions versus the evidence that says the contrary, that this vaccine is safe. That's the only thing I'm saying. I had to get that off my chest right quick, Dr. Ledo. I had to get it off. Burn in my chest.
Come, as they used to say in my church, come to us in your own way. All right. I'm now going to the second segment of our program with Dr. Glenda Newell Harris. Dr. Harris is the author of the book, Focus on Your Better Health. I never get that title right. Did I get it right this time, Glenda?
Focus on your best.
On your best health. All right. Well, now I got it in front of me, so I won't make that mistake. I want to start this conversation by saying, if you do not have but one book in your library, you need to get this book. Because one of the reasons we started the African American Wellness Project was because I, as a Black doctor, was infuriated at the way you were treated in the healthcare system. I looked at the way in which you enter the system, the way you have been divided in the system by people, the way you are not given the same treatment, the way you're not talked to in the same way, and the way it affects outcomes for any of you with chronic diseases. And I personally believe that it is a major factor in the whole situation related to how we as African Americans are less healthy. I think we want to start very quickly with a video, and then we'll go into a discussion with Dr. Newell. Maybe not so quickly.
This is the second worst day here at IU North. Yesterday, a Dr. Bannock, Bannec, wanted to send me home. You know, at that time, I'd only received 2 treatments of the remdesivir. He said, you don't need it. You're not even short of breath. I said, yes, I am. Then he went on to say, you don't qualify. I must have, because I've gotten 2 treatments. Then he further stated, you should just go home right now. And I don't feel comfortable giving you any more narcotics. I was in so much pain from my neck. My neck hurt so bad. I was crushed. He made me feel like I was a drug addict. And he knew I was a physician. I don't take narcotics. I was hurting. So spoke to patient advocate who left me wanting. There's not much I can do. So I started asking, send me to another hospital where they can treat me. And if they're not going to treat me here properly, send me to another hospital. Well, next thing I know, I'm getting a stat CT of my neck with and without contrast. The CT went down a little bit into my lungs, and you could see new pulmonary infiltrates, new lymphadenopathy all throughout my neck. And all of a sudden, yes, we'll treat your pain. You have to show proof that you have something wrong with you in order for you to get the medicine. I put forward and I maintain, if I was white, I wouldn't have to go through that. And that man never came back and apologized. This Dr. Bannock guy. And then today now, supposed to be getting the narcotics, right? They came in 9 o'clock. I've been in pain since 7. And when they came in, very, very sympathetic. Yeah, we will get you pain medicine. I don't want to give you IV narcotics. How about PO? Fine. I just want my pain to end. So then he says, well, what pain medicine? I said, I don't know. I don't take them on a regular basis. I don't even write for them. All I know is that I'm in intense pain and morphine worked. Okay, well, we'll give you Percocet. Okay. I don't know nothing about it. I don't think I've ever had it. It was another 2.5 hours before I got the pain medicine. The nurse came in. The first thing I said to that nurse was, why did I have to wait for so long? The nurse snapped back. Well, you're not my only patient. I have 5 other patients, you know. I said, I have been in pain since 7 a.m., you know. Well, I can't be in here every 5 minutes. I said, no, you were in here once in 4 hours. What? I was in here 1.5 to 2 hours ago. That was once, since your shift started at 7. Well, I had other people, and I had to take the shift change. We had to give report. I am a patient. Are you going to take care of me or not? And he went in. Now, that is not how you treat patients. Period. So I don't trust this hospital, and I'm asking to be transferred. These people wanted to send me home with new pulmonary infiltrates and all kind of lymphadenopathy in my neck. The other thing that white Dr. Bannock said was that if I stayed, that he would send me home Saturday at 10 p.m. in the dark. Who does that? On a week, who does that? And that nurse was telling me, oh, I was marching in Black Lives Matter. I told him, no, I don't believe none of that. Not one bit, not one iota. He wouldn't even know how to march. Probably can't even spell it. This is how Black people get killed. When you send them home and they don't know how to fight for themselves. I had to talk to somebody, maybe the media, somebody, to let people know how I'm being treated up in this place. And he gladly told me, I know you're a doctor. So he didn't want the Black doctor to have no medicine, nothing. And then had the nerve to say it's because of him, the nurse, that I got the medicine. Really? Because of you? No. How about it's because I had that stat CT in my neck where it showed all of that lymphadenopathy and infiltrates? Yeah, you didn't know about that? You didn't get that in report? That's what I said. To being Black up in here, this is what happens.
That certainly is a stinging indictment of the healthcare system that we all see as African American physicians. You know, we know and notice that this is the kind of thing that happens every single day in doctors' offices and hospitals across the country. So we bring in now Dr. Glenda Newell Harris. She is the author of a book on Focus on Your Best Health. She wrote the book in the same way that, for the same reason that we started the African American Wellness Project, because she wanted you to understand how the system works and how you can take advantage of it. Dr. Newell, let me start with the question. Is this an unusual set of circumstances? This is a doctor. I want people to understand this is a doctor in the intensive care unit. Is this happening? Is this a unique situation, even for doctors?
Well, first of all, thank you so much, Dr. Lenore, for having me back on your podcast. I'm delighted to be here and also with Mr. Dean. As I was watching my colleague, Dr. Moore, speak, the saddest part about this is that this is not a unique. This happens all too often. The lack of sensitivity, the lack of opportunity, delaying of medication, lack of communication. It's because of all of these things that motivated my co-author, my colleague, my friend and I, Dr. Spriggs, to write the book, Focus on Your Best. It's because of experiences that we have had as medical doctors being at the bedside of our loved ones. It's because of experiences of our friends that we have been asked to go to bat or raise questions or have conversations or intercept or intercede. Because of things like this that motivated us to write the book. And what we wanted to do was to take this as an opportunity to share some information that would hopefully be able to empower you, our listeners, so that you might be able to be your best advocate. Dr. Moore, as a medical doctor, just imagine. She knows the process. She knows the history of the present illness. She knows about the physical exam. She knows about the testing that's necessary. And yet she's there in her bed, sick. She's the patient this time and has to beg for pain medication. And the lack of sensitivity and really disrespect. And she's ill. And there are many times you find yourself in an emergency room or in a doctor's office and you're ill. And that is a time when you need an advocate because you can't advocate for yourself and be sick at the same time. But that is exactly what she was trying to deal with.
Yeah, you know, we've talked with you before about this issue. We shared with our audience some of the experiences we've had as doctors. But what I want to focus on today is the steps that people need to take that are outlined in your book about getting good care. Basically, three things that you focus on: communication, navigation, and advocacy. Communication, I think, is something that we all expect. It comes in a number of different ways. So I want to focus in the time that we have today on the navigation and advocacy. You talk about, so we're going to talk about what you need to do. But in this book, there are examples of why you need to do it. And I bet there are millions of Black people out there where they don't need the examples. They've had the same kinds of experiences. So let's talk about some of the things you need to successfully navigate the system. Things like selecting a doctor, understanding the visit.
Absolutely. In fact, that's the number one thing regarding navigation. The most important thing, I got an email last night from a friend that was in the emergency room and she was treated and cared for. And the very first thing they said afterwards was, follow up with your primary doctor. And she emailed me and said, I don't have one. Where do I find a primary care doctor? So many of us, we go to specialists for care, but finding a doctor and identifying a primary doctor is one of the most important things you do. Where do you find them? Well, I always say the best report for another doctor is another patient. So ask your friends who their primary care doctors are. And when you go to identify a primary care doctor, what are the things that you should be looking for? Well, first of all, you want to make sure that they're in your network. Are they in your health insurance network? Are you going to be charged a lot of extra money because this person is out of network. That is important. You might say, "Oh, my health care, I'll give up everything for my health care." But at the end of the day, there are a lot of doctors, and many of them are within the health field. So we want to find out if they're.
So Glenda, can you lean into the microphone
Yes.
a little closer? Yes.
Okay. Okay, sure.
Right.
The other thing you want to look at is where are they located? Are they physically close to you? Can you get to them from the standpoint of from your home or your work? Do they have hours after do they have office hours after 5 o'clock or on the weekends for you to be able to see them during those times? Are they solo practitioners? Or might you come into their office sometimes and maybe they will have a physician assistant or a nurse practitioner? I think that's a tremendous asset. But again, you need to know who you're seeing, which is another point. When you're in an environment, and your medical environment, you need to know who the medical doctor is. You need to know who the physician assistant is. You need to know who the nurse practitioner is. And you need to know who the registered nurse is. So those are things that you need to, that's part of communicating and navigating so that you can know to make certain that you ask the right question to the right person.
Dr. Newell, too many people get assigned a doctor by their health plan. And somehow they feel, like they're like prisoners of war, that they can't select them, they can't get out, they can't opt out. My feeling is that sometimes you need to go in and interview these doctors, because with an interview, what you do is you get to see the office. You get to see, because many times, and I think Black people know, the office staff think they're better than you are. Immediately, they don't, if they count the number of other patients. Well, when Black patients come in there, that's like a side effect, of being in practice. So you really need to see the whole system, and before you select the doctor, not just the doctor, but also the medical assistants, the nurses, and the other things. And then you need to be able to communicate with that doctor and be able to make certain that the conversation goes well.
Absolutely. You want to make sure that the doctor listens to you. If the doctor talks a lot of jargon to you, that's not going to work. You need to make certain that the doctor talks to you, not down to you or using jargon. The other thing you want to find out is, where does this doctor have hospital privileges? That's another very important thing. And then you need to know the hospitals in your community that are the stroke centers.
Are all hospitals created equally?
Not at all. Not at all. You want to know where are the stroke centers. You certainly don't want to roll up into a hospital with chest pain and they have no cardiothoracic unit. You certainly don't want to roll up into a hospital with numbness and tingling on one side and it's not the stroke center. You'll find yourself perhaps not having the best outcome. Those are all parts of the interview. And Dr. Lenore is absolutely right. Really, the relationship between patient and doctor, it is a chemistry. It is a chemistry. And sometimes it works and sometimes it doesn't work. Because after all, we're asking you all kind of questions. But let's also focus on a few other things about navigating the system. It's very important that you understand your medical condition. You need to know what your medical problems are. And those that are under the sound of my voice, we want you to know what your medications are. If you can go into the doctor and say, I take hydrochlorothiazide, 25 milligrams, not a little pink pill, I don't know what it is, and I take it sometimes. You need to know what your medical conditions are. You need to know what your medicines are. You need to know how frequently you take them. And then you might want to learn a little something about what they are. If you're on a blood thinner, you need to know this. You, just like you asked what, I just was listening, you want to know what's in that vaccine? You want to know what's in that food that you're eating? You want to know the medications that you're taking so that you can be intelligent about sharing that with the emergency room doctor, so that the emergency room doctor or the dentist won't end up giving you medicine like Advil and Naproxen for taking Eliquis or Xarelto, which are all blood thinners.
Can I ask you a question? Does the fact that you're the CEO of some big company, are you the vice president of one of the Google offsprings, or that you are the minister of the biggest church in town, does the system see you differently because you are an important Black person?
Not at all. And you can talk to some very high-profile people who have had experiences in the emergency room, and they will tell you that. You may walk into an emergency room and say, "Oh, they know." I mean, in fact, I will tell this story. Congresswoman Barbara Lee has told this story over and over again. And when her mother was living and she was here, she marched right into the emergency room and think for whatever reason, because she was our congresswoman, that somehow things were different. And this has been one of the major reasons why our congresswoman has also been an advocate for this very kind of thing. The importance of being an advocate for yourself, for your health care. So no. And I'll tell you another thing, Dr. Lenore. Just because you have 5-star insurance and you are the CEO, you may or may not get the same, and God forbid that you may be a Black or brown person. Your health care is not going to be dependent upon the fact that you have 5-star health insurance and that you're on the 5th floor of a building with a shower and a suite. It is.
I've often said that if I'm in a strange town and I get chest pain, or what I'm gonna do is try to rent me a suit, get me a briefcase before I go to the emergency room, because otherwise it's a catch as catch can. It's a phenomenon that you're gonna get any kind of significant equal treatment. We're not talking about special treatment. We're talking about equal treatment.
Yes.
So I had a question, and I was thinking in my head, I was like, are some of the most powerful tools you can use to be your own health advocate is a pencil on a piece of paper when you meet your doctor? So you start writing down some of the things that they say, because I think that as an end user, as a non-doctor, I think that if you walk in there and you're writing down the things that your doctor says, they're going to say, "Oh, this person is serious." You're sending the message, an unspoken message, that I'm serious about my health. I am listening to what you're saying. And if what you tell me today that I wrote down doesn't turn out to be true, we're going to have another conversation when I come back in here. Can that help people become their own best health advocate?
Absolutely. Dr. Lenore, I will take his comment. He has said many times that when he's seeing patients and he sees the patients starting to write or come up with this, he becomes even more attentive himself. I mean, there's nothing more important than us as physicians seeing that you care about your health enough to be able to bring in your own blood pressure readings, bring in your blood glucose, not, "Oh, doctor, I check it sometimes," but bring those tests into the office with you so that they can be reviewed. The other thing I will also say, Mr. Dean, is in being your own advocate, you might want to purchase a few little things that will help you be able to objectively give information to the doctor. Not only your blood pressure, not only a glucose monitor, but people need to buy pulse oximeters now. They're being made available, in particular during these COVID times. People that have asthma should have peak flow needles, so that they're calling the doctor, not saying, "Oh, I'm not sure I'm breathing well," but that you're telling the doctor what your peak flow is. So
what is a pulse oximeter? I think for some of our audience, what's a pulse oximeter? Let's
okay.
Yeah.
A pulse oximeter is a very small unit that allows, by sticking your index finger into this little unit and it clamps down on your finger, it allows you to be able to determine how well you're getting oxygen around in your blood. It will also give you a pulse reading. Many of them will. And so for those who were suffering with COVID last year, this was actually a little unit that many people got when they were leaving the emergency room. The emergency rooms were giving these units to people saying, "Well, when it drops to a such and such level, you need to do that." So part of this navigation is navigating your way to get the objective information so that you can talk to the doctor to listen. You go into the doctor saying, "I don't feel well," that's one story. But if you go into the doctor saying, "Doc, I took my blood pressure this morning and it was 90/60. My pulse rate is 140. And my O2 sat on my pulse oximeter is showing 70.
Hey.
We'll go to the front of the line."
And I think that you're right. And I think so many people have had this experience that I think that it's important before we move to advocacy to realize that Dr. Glenda Newell Harris and Dr. Brenda Spriggs have written a book, Focus on Your Best Health. That book is available, should be in every Black family's home. And you should read it as you construct your healthcare system. That's what the African American Wellness is all about. And that's what we try to do in all of our projects. And so consequently,
You can snuggle your book. You can snuggle Dr. Newell Harris' book right between your Bible and your copy of Roots.
That's right.
Right between those two books.
Let's move on a bit from navigation of the system, recognizing how important it is for you to help and control your own healthcare system, to advocacy. Tell us what's an advocate and why that's important.
An advocate, Dr. Lenore, an advocate can come in many different varieties and forms. There can be peer advocates, there can be professional advocates. Honestly, I think the first advocate that we know most about are mothers or fathers that bring their children to the doctor. Children are often not able to give the information, and that's where you actually have served in that role. Or if you have an elderly parent that you are taking to the doctor and you're providing information, that is an advocate. But there are also individuals that are professional advocates, and Dr. Spriggs and I have served in those roles in the past, and those are individuals that have health as a background. It can be a registered nurse, it can be a nurse practitioner, it can be a physician assistant, someone that understands and knows the healthcare field. And that person is able to take the medical knowledge that they have and then take a good history from you, and they go in and they sort of speak on your behalf. In particular, for like my colleague, Dr. Susan Moore, who wasn't able to speak for herself. You saw she was gasping for breath there with the nasal cannulas in her nose. That was oxygen going into her nose. But whenever you're in an emergency room setting, you want to bring someone with you, an advocate. That's a person that's going to look out for you. You're going to ask questions. And we often talk about being, agreeably aggressive or politely assertive is the term that we utilize in our book. It is important to be politely assertive. It's a little bit like when you go to the restaurant, when people are cooking your food, you may not be happy, but you really don't want to tick off that person that's delivering it to your table for fear. So I say you want to be astute and respectful when you're communicating. But I'll tell you something else for being on the other side. I too pay attention when family members begin to start asking me questions about the care that is being provided to their loved one by me, because it demonstrates an interest, and the doctor needs to be open. That's another thing. If your doctor is intimidated by you asking questions, and that's a reason I'm flipping over a little bit on the navigation, that you may need to think about looking for another doctor. But back to the advocacy piece, you should never go to the emergency room with an advocate. When you're going to a new doctor, you need to take an advocate. If you think that your doctor is going to be giving you back biopsy results from something, or perhaps potential bad news, or news that you may not be prepared for, you want to bring an advocate, someone that will be there, that will be level-headed, that will have a pen and paper, as Mr. Dean pointed out, that will be able to ask questions and write answers to questions down. And then you want to ask, and doctor, when I get home, and I have other questions that I've thought about that I can't think about right now, because when you're in crises, really all you're thinking about doing is trying to get well. You only think of those other questions when you're beginning to feel better. But you need to be able to have that open door to find out, when will the doctor be available, or who will I be speaking with? Will your nurse practitioner or physician assistant be available? So, but we believe from our book that if you effectively communicate, and if you know how to be a savvy navigator, then you will be your best advocate. But it takes communication and navigation in order to be able to advocate.
Now, tell me, one of the things that I've found is that an advocate is especially important in the hospital. I mean, because what happens is the doctors tend not to want to talk to you. They don't want to explain to you what needs to be done. I mean, I get more calls from people who are in hospitals all across the country, Their relatives are in hospitals without non-COVID situations, and they're still not getting the information they need. So I'll call over there and I'll say, I'm Dr. Lenore, my cousin's in the hospital, and we're not sure what's going on. And I can tell you immediately the situation will change. But you have to identify that advocate before somebody gets sick. Every family, no matter how large or how small, should have an advocate. And it shouldn't be your brother who's watching the health shows on TV. It needs to be somebody who knows the system, understands what's going on, can create a presence so that the system takes notice. And I hate to say it, too often we're docile when our families are sick and we're not getting the right information. But I say this, and I say this probably more, and probably the last time I'm going to say it. But if you are as mad about healthcare that's foreign quality and not explainable as somebody cuts in front of you in the ticket line or the Safeway line, then you wouldn't have this kind of problem. And so it is important that that advocate have some health training. Would you agree, Dr. Newell?
Yes, I absolutely agree, because you really want to. It's really like, I hate to be sexist about it, but it's really like for me to take my car to the car shop. If I can't talk the mechanical jargon, then I may come back home with more than a new battery. I may have a whole new engine because they've convinced me that that's what I need, because I don't understand what goes on under the hood. You absolutely need. I actually had a recent situation with a family member where a family member was taking a certain medication. The family member had an adverse reaction to the medication, so they had to come off of the medication. And by me being a medical doctor, I looked at the medications and I said, why don't we just increase the ones that we're working with rather than start a new one? Can't we push this one that you are on a little bit higher? And sure enough, when it was time for the visit, that was the recommendation, and the doctor completely agreed. Oh yeah, that's a good idea. I sort of thought to myself, yeah. But if you care about your loved one, it doesn't matter who's really getting paid. You just want to make sure that your loved one is getting the best care that they deserve. So reach out to many of you. A lot of people have doctors in your family and nurses in your family, but make sure they understand the disease and can talk, be politely assertive, so that doctor knows you're not going to walk away with just, as we used to say, the okie dokie. You really want to have the facts, and you want to make sure that your loved one and the care of your loved one is their priority.
Well, one quick question, Dr. Glenda. I think families should also have a plan, right? An emergency care plan. So that way, if the advocate, the family advocate is not there, hey, pull out the drawer. Here's what we should do. Just like you've got a plan in emergency. If there's a fire, you should have a plan in case of emergency. Take that with you. You're on the road. If you're on vacation, you've got that plan. Oh, here's all the information I need to know. Here's my doctor back home. Here's what the conditions are. So that way, even if you're not with your advocate, even if you're not in a situation, you've got that plan, you've got that card, you've got that information available to you, because it's not always going to be in a situation where you can go and get it done in the right order.
All right, so Dr. Newell, we weren't able to focus on everything in the book. I just want people to understand.
That's why you got to buy it.
I want people to understand how important this book will be for you and your family. Not only does it outline the problems, it gives you significant strategies to use in the area of communication, navigation, and advocacy. Dr. Newell, other than on the AA Wellness Project .org site, where can they get copies of your book?
Actually, they can go to FOYBH, Focus on Your Best Health. Just take those initials at Yahoo, and they can purchase it right there. FOYBH, the first initials of Focus on Your Best Health, and they can find it right there. They can purchase it, and it will be sent off to them. One more thing, Dr. Lenore, if I could, in terms of advocacy, don't forget, we have big HIPAA laws. So I can't advocate for you if grandma didn't give the doctor permission to talk to me. So make sure that you get that straight. As Mr. Dean was talking about a plan, You make sure that your advocates, whether they live in Texas or whether they live in New York, get their names on your loved one's charts. Because I have to tell you, I have trouble. It's like getting through Fort Knox to try to get information on my own husband. When I call and call and call, well, wait a minute, we're not sure we have permission to talk to you. And I'm like, no, I was right there when he gave it to you. So, you know, the HIPAA can go a little far. So just make sure you have that taken care of in the record.
All right, I'd like to thank you, Dr. Newell, for joining us again. You'll be a regular. Your book is the Bible. It is the cornerstone of the African American Wellness Project philosophy. And as Dr. I give this to Dr. Jeffrey Watson, who said, if you knew better, you do better. And I think this book helps you to know better. So thanks to Dr. Brooks for taking the time to update us on the coronavirus situation now and in the future. Now, next week, we'll be talking about allergy. I am going to be the guest. I don't want to sit here for a whole hour and listen to myself talk. I want you to get your friends, your relatives, everybody who wants to have any question answered about allergy, especially during this season, to join us next week on the AA Wellness Project Watch. So thank you, Dr. Newell. Thanks to Dr. Brooks. And thank you, Mr. Dean. And remember that health is your biggest asset, so protect it.
Thank you.